Thank you. So good afternoon. Thank you for joining us. Today I'm here to talk to you about Health Canada's authorization of Moderna's Spikevax COVID-19 vaccine for children 6 months to 5 years of age. This is the first COVID-19 vaccine authorized in Canada for this age group, which means that approximately 1.7 million children in Canada are now eligible to be vaccinated against COVID-19. Health Canada received Moderna's submission for children 6 months to 5 years of age on April 29th, and this submission built upon data from clinical trials in adults and older children, as well as the experience of administering hundreds of millions of doses worldwide. Health Canada authorized this vaccine as a 2-dose primary series administered 4 weeks apart. It's a smaller dose of 25 micrograms, which is half the dose authorized for children 6 to 11 years of age, and 1/4 of the dose authorized for people over the age of 12. The clinical trial showed that the immune response to Spikevax in children 6 months to 5 years of age was similar to that seen in people 18 to 25. And the clinical trials were conducted when Omicron was the predominant variant circulated in Canada and the United States. Efficacy estimates among participants 6 months to 5 years of age are similar to those in adults during the Omicron wave. As with all clinical trials, the children in the study were followed closely for any reports of side effects. And the vaccine was well tolerated, with no unexpected safety issues identified. The most frequently reported adverse reactions were irritability or crying, pain at the injection site, sleepiness, loss of appetite, and fatigue. The reactions were usually mild to moderate, resolving within a few days of vaccination, and no serious adverse reactions were reported. As with all authorized COVID-19 vaccines, Health Canada has issued terms and conditions to the manufacturer, requiring them to closely monitor any emerging safety issues, including any cases of myocarditis and pericarditis. Health Canada and the Public Health Agency of Canada will continue to work with provinces and territories, the manufacturer, and regulators around the world to monitor the safety of the vaccine. And we know that this collaboration has been able to quickly identify even the very rare and unexpected side effects that we've seen. This authorization comes at a critical time in the pandemic as we progress through the 7th wave. And though children are less likely to experience complications from COVID-19, they can still get very sick. And children, like adults, can spread the virus. Emerging data also suggests that children with COVID-19, regardless of severity, can develop long COVID. And rarely, some go on to develop multi-system inflammatory syndrome in children, which has a very high risk of hospitalization. There have been many questions over the last few weeks as well about new vaccines targeting the Omicron variant. Health Canada received a submission on June 30th from Moderna for its bivalent vaccine targeting both the original strain of the virus and the Omicron BA.1 strain for use as a booster in people 12 years of age and older. In addition, Moderna has indicated it plans to study a booster dose for children under 6 years of age targeting the Omicron variant and the original strain of the virus. Other manufacturers have also indicated that they plan to make submissions for bivalent boosters for adults in the coming months. However, it may take some time before they make submissions for younger children. And vaccine manufacturers typically first conduct trials in adults and adolescents and then extend the studies to younger age groups, and this takes time. It's still important to remember in the meantime that the vaccines used in Canada are very effective at preventing severe illness, hospitalization, and death from all strains of COVID-19. And are the best tool we have available to protect ourselves, our families, and our friends. Now that the vaccine is authorized, I'm sure everyone is anxious to hear how it'll be used, and Dr. Njoo will be providing an update shortly. Thank you. Merci. Miigwech.
Bonjour, merci de vous joindre à nous. Je vais vous parler aujourd'hui de
Hello, thank you for
l'homologation par
joining
Santé
us.
Canada du vaccin
I'd
contre la
like to
COVID-19
talk to you
Spikevax de
about
Moderna pour une
Spikevax, Moderna's
utilisation chez les enfants
vaccine,
âgés de 6 mois
and
à
its
5 ans.
use
Il s'agit du
for
premier vaccin
children
contre la COVID-19 homologué pour ce
after
groupe d'âge
6
au
years of
Canada,
age.
ce qui signifie qu'environ 1,7 million d'enfants au Canada
1.7
sont
million
maintenant
children
éligibles à la
in Canada are
vaccination
now
contre la
eligible
COVID-19.
for this
Santé
vaccination.
Canada a reçu la
Health
présentation de
Canada
Moderna concernant les
heard
enfants de
Moderna's
6 mois à 5 ans
presentation
le 29 avril.
with respect to
La
children
présentation
of
s'appuie
6
sur
months
des
to
données provenant
5.
d'essais cliniques menés chez
These
des
are
adultes et
data
des enfants
from
plus
the
âgés,
clinic
de même que
for
sur
children
l'expérience
and
de
those older,
l'administration partout dans le monde de centaines
and
de
this
millions de doses du vaccin.
because of the
Santé
millions of
Canada a
doses
homologué ce vaccin pour
given in the
l'administration d'une
world.
série primaire de vaccination
There
de
will be
2
a
doses
primary series of
administrées à
Moderna
4 semaines
Spikevax,
d'intervalle.
which
Il
can be
s'agit d'une
offered
dose
at
réduite de 25
6
microgrammes,
weeks of
ce qui représente la moitié de la dose homologuée pour les
50
enfants de 6 à
milligrams
11 ans
for
et le quart
children
de la
from
dose homologuée
6
pour les
to 11
personnes
years
de
of
plus de
age.
12 ans. Lors de l'essai clinique, la réponse immunitaire des enfants
It seems
âgés de
that
6 mois à
the
5 ans
immune
au vaccin
response of
Spikevax était
children to the
similaire à celle
Spikevax was
observée
similar to
chez les
those
personnes de
observed
18 à
in
25 ans.
people of 18 to
Les essais
25.
cliniques ont été menés alors que le variant
Clinical
Omicron
trials
était le principal
were
variant en circulation au
performed
Canada et aux
while
États-Unis.
there was
Les
another
estimations
variant
d'efficacité chez
in
les
Canada. The
participants âgés de 6 mois à
efficacy
5 ans étaient
for
similaires
those
à celles des adultes
6
pendant
months
la
to
vague
5 years
alimentée par le variant Omicron.
were during the
Comme
Omicron
pour tous les
wave.
essais cliniques,
As
les
for
enfants
all clinical trials, children
participant à
took
l'étude
part,
ont été suivis de près
taking
pour
part
toute
rather, were
déclaration
closely
d'effets secondaires. Le vaccin
followed
a
in
été
order
bien
to note
toléré
any
et
secondary
aucun effet
effects.
secondaire inattendu
There
n'a
were
été
no
relevé. Les
major
réactions
side
indésirables les plus
effects.
fréquemment
The most,
déclarées incluaient
for the most
l'irritabilité ou
part,
des
there
pleurs,
was
une douleur
irritability,
au site
crying,
d'injection, de la
pain at the
somnolence, une
injection
perte
site,
d'appétit
sleepiness,
et de
loss
la
of
fatigue.
appetite, and
Les réactions
fatigue.
étaient généralement d'intensité légère à
Reactions
modérée et
were
disparaissaient en
mild to
quelques
moderate
jours
and
après la
disappeared a few
vaccination.
days after the
Aucune réaction
vaccination.
indésirable grave n'a été
No
signalée.
serious
Comme pour tous les
undesirable
vaccins
side
contre
effect
la
was noted.
COVID-19 homologués, Santé Canada a imposé aux
Health
fabricants des
Canada
conditions qui
has
l'obligent à faire une surveillance
told
étroite de
the
tous nouveaux problèmes
manufacturer
d'innocuité,
to
y compris des
closely
cas de
follow
myocardite ou de péricardite.
any possible problems,
Santé
including
Canada et l'Agence
myocarditis.
de la
Health
santé
Canada
publique du Canada
and the Public
continueront de
Health
travailler
Agency of
avec les
Canada are
provinces et les
working with
territoires,
provinces and
le fabricant
territories
et
and
les organismes de
manufacturers
réglementation du monde
and
entier pour surveiller
regulatory
l'innocuité du vaccin.
organizations
Nous savons que
worldwide
cette
to
collaboration a
make
permis de
sure
cerner rapidement
that this
même des effets
vaccine
secondaires
is
très rares
safe,
et inattendus.
because we
Cette
want to be aware
homologation
of
arrive à
even
un moment
rare and
critique de la
unexpected
pandémie,
side
alors que nous
effects.
sommes au début d'une 7e vague.
We are
Même
at
si
the
les enfants
beginning
sont
of a
moins
7th
susceptibles de développer des
wave,
complications de la
and
COVID-19, ils peuvent tout de même être très
children aren't
malades. Et
likely
les
to
enfants, comme
develop
les adultes, peuvent
bad
propager le
cases of
virus.
COVID, but they can
Selon des
still
données émergentes, les
be
enfants qui
contagious and
contractent la
propagate the
COVID-19,
virus.
peu importe la gravité de leur maladie, peuvent
People
développer la
who
COVID-19 de
get
longue durée.
COVID,
Et dans de rares cas,
even if it's
certains peuvent
not,
développer le syndrome
even if they don't have
inflammatoire
serious
multisystémique
symptoms,
chez l'enfant,
they can still get
associé à un
long
très haut risque
COVID
d'hospitalisation.
and are
Beaucoup de
therefore
questions ont
associated
été
with a
posées
greater
au cours des
risk of
dernières semaines à propos des nouveaux
hospitalization.
vaccins ciblant le variant
There
Omicron.
are
Le
new
30 juin,
vaccines
Santé Canada a
targeting
reçu de Moderna une présentation
COVID.
concernant un vaccin
There
bivalent
was a
qui cible à la
presentation
fois la
by
souche virale
Moderna
d'origine
of a
et la souche
vaccine
BA1 du variant Omicron
that
pour une utilisation chez les
targets
personnes de
the
12 ans et plus.
stem cells of
L'entreprise
this
Moderna a aussi
illness.
indiqué qu'elle prévoit étudier
Moderna also
l'administration
said
aux
that
enfants
they
de moins de
want
6 ans
to
d'une
study
dose de rappel ciblant la souche
the
d'origine du coronavirus et le
administration
variant
of
Omicron.
this vaccine
D'autres
and
fabricants ont
also
aussi indiqué qu'ils
discuss
prévoient
booster
soumettre des
doses.
présentations pour des doses
They
de
said that
rappel de
they
vaccins
intend
bivalents au cours des prochains mois.
to
Mais il pourrait s'écouler un
present
certain
on,
temps avant qu'ils
give a
en soumettent pour les
presentation
jeunes
on
enfants.
a
Les fabricants de vaccins
bivalent
mènent
dose.
habituellement en premier les essais cliniques chez les adultes et les adolescents, puis
The
étendent leurs
first
études aux plus
trials were
jeunes,
on
ce qui prend
adults
donc un peu plus de temps.
and younger people, but
Il est
now it's
important
going
de
to be
rappeler
done
que les
with
vaccins
young
administrés au
children.
Canada sont très
Vaccines
efficaces
given
pour
in
prévenir
Canada
les
are
cas
very
graves,
effective
les
in preventing
hospitalisations
serious
et les
cases,
décès, et ce,
hospitalization,
pour toutes
and
les
deaths,
souches
and
responsables
this
du coronavirus
for
responsable de la
all
COVID-19. La
variants.
vaccination demeure le meilleur outil dont nous disposons pour nous
Vaccination
protéger
remains the
et
best
protéger nos
way to
familles
protect
et
our
nos amis.
families and our
Maintenant
loved
que le
ones.
vaccin a été
Now
homologué,
that
je
the
suis certain que vous êtes intéressés à
vaccine
en
is here,
savoir
I'm sure
plus
you'll
sur
be
la façon
interested
dont
to
il
know
sera
more
utilisé.
about how it
Le
will be
docteur
used.
Njoo va maintenant vous
Dr.
présenter sa
Njoo
mise à jour.
will now
Merci.
give an update. Thank you.
Bonjour et merci, Dr. Bertillon.
Thank you,
Bonjour
Dr.
à
Bertillon.
toutes et à tous.
I'd like to
Vaccination is an
say hello
important
to
tool in
all.
our response to the COVID-19 pandemic, and it remains one of the most effective ways to protect against serious illness, hospitalization, and death from COVID-19. Given that some provinces have entered a summer wave, today's announcement on the authorization of a vaccine for children under 5 years of age is welcome news. A COVID-19 vaccine to protect young children has been long anticipated by many parents in Canada. Today's announcement provides parents and caregivers with a vaccine option to protect younger children in their care against COVID-19. The National Advisory Committee on Immunization, or NACI, has carefully reviewed the available evidence on the safety, efficacy, and immune response generated by the Moderna Spikevax COVID-19 vaccine, as well as the spread and severity of COVID-19 in children under the age of 5. NACI is recommending that a complete 2-dose primary series of the Moderna Spikevax COVID-19 vaccine may be offered to children aged 6 months to 5 years who do not have contraindications to the vaccine. NACI recommends at least 8 weeks between the first and second dose. For children 6 months to 5 years of age who are moderately or severely immunocompromised, NACI recommends that a primary series of 3 doses may be offered with an interval of 4 to 8 weeks between each dose. This is because people who are immunocompromised may have a lower immune response to COVID-19 vaccination. Infectious diseases like COVID-19 are unpredictable. Although younger children are less likely to get very ill from COVID-19, some can get really sick, including previously healthy children. Since Omicron became the dominant variant, more children have become infected, and the number of hospitalizations and ICU admissions of children under 5 years of age with COVID-19 has increased. COVID-19 vaccination in younger children will increase their protection against severe illness. Even if a child has been previously infected with COVID-19, vaccination is still important. While infection alone provides some protection, vaccination helps improve the immune response and can provide stronger and longer-lasting protection. For children under 5 years of age who have already had COVID-19, NACI suggests waiting 8 weeks after the start of COVID-19 symptoms or a positive COVID-19 test before beginning or continuing the primary series. This interval may be shortened to 4 weeks for children who are moderately to severely immunocompromised. At this time, NACI recommends that children 6 months to 5 years of age receive this vaccine 14 days before or after receiving a non-COVID-19 vaccine. This precaution will help determine if a side effect that may arise following immunization is due to the COVID-19 vaccine or a non-COVID-19 vaccine. There may be circumstances when it is necessary for a dose of this vaccine to be given at the same time as another vaccine, in which case a healthcare provider can help with decision-making. Based on provincial and territorial projections, there will be sufficient supply of the Moderna Spikevax vaccine for children 6 months to 5 years of age. The Government of Canada is working closely with provincial and territorial partners and understands they will be rolling out vaccination programs for children in this age group shortly. Please check your provincial, territorial, or local health authority website for information on when the vaccine will be available in your area. Starting a primary series now will provide some protection to these young children. It is also an opportune time to remind everyone to stay up to date with COVID-19 vaccines and the boosters recommended for them. While this authorization and NACI recommendations will come as a relief to many parents of young children, some may still have questions about vaccination. Parents and caregivers should speak with a trusted healthcare provider if they have questions. Information is also available on your federal, provincial, territorial, or local public health authorities' website. Thank you. Merci. Miigwech. Bonjour à toutes et à tous. La vaccination est un outil
Hello,
important
everyone.
dans le cadre de notre
Vaccination
intervention
is
contre la
a
pandémie de
very
COVID-19
important tool
et elle
in
demeure
dealing with
l'une des façons
COVID-19,
les
and it
plus
remains
efficaces
one of the most
pour se
effective
protéger
ways
contre une
to
maladie grave,
protect against serious
l'hospitalisation
illness,
et le décès
hospitalization,
attribuable
and
à la
death
COVID-19.
from
Certaines
COVID-19.
provinces étant actuellement aux prises
Given that
avec une
some
vague
provinces
d'été,
have entered a
l'annonce
summer wave,
d'aujourd'hui
today's
en ce qui
announcement
concerne
on the
l'autorisation d'un
authorization of
vaccin
a
pour les
vaccine for
enfants âgés de
children
moins de 5 ans
under 5 years of
constitue
age
une bonne
is
nouvelle.
welcome
Un
news.
vaccin contre la COVID-19
A
pour protéger
vaccination
les jeunes
against
enfants
COVID-19 to
est
protect
attendu depuis
children has
longtemps
been
par de nombreux parents au
hoped
Canada.
for a long time by
L'annonce
many parents in
d'aujourd'hui offre
Canada.
aux parents
Today's
une option
announcement
vaccinale pour
will
protéger les jeunes
offer
enfants dont
parents and
ils prennent soin
caregivers
contre la
a vaccine
COVID-19.
option to
Le
protect
Conseil
children
consultatif national de
against
l'immunisation, ou CCNI,
COVID-19.
a étudié
The
attentivement
National
les
Advisory
données
Committee on
probantes
Immunization,
disponibles
NACI, has
quant à
carefully reviewed the
l'innocuité,
available
à
evidence on
l'efficacité
safety,
et la réponse
efficacy, and immune
immunitaire du
response
vaccin Spikevax
generated by the
Moderna
Moderna
contre la
Spikevax
COVID-19, ainsi
COVID-19
qu'au sujet de
vaccine,
la
as
propagation
well as the
et la
spread and
gravité de la
severity of
COVID-19 chez
COVID-19
les enfants
in
âgés de
children
moins de
under the
5 ans.
age of
Le
5.
CCNI recommande qu'une
NACI
série
is
complète de
recommending
doses de
that a
vaccin
complete
Spikevax
two-dose
Moderna
primary series of
contre la
Moderna
COVID-19
Spikevax
soit
COVID-19
offerte
vaccine
aux enfants
may
âgés
be
de 6
offered to children aged 6 months to 5 years who do not have contraindications to the vaccine. It also recommends that at least 8 weeks be allowed between the first and second dose. For children from 6 months to 5 years of age who are mildly to severely immunodepressed, NACI recommends a primary series of 3 doses with an interval of 4 to 8 weeks between each dose, since immunodepressed persons may have a weaker immune response. Infectious diseases like COVID-19 are unpredictable. Although younger children are less likely to get very ill from COVID-19, some can get really sick, including previously healthy children. Since Omicron became the dominant variant, more children have been infected, and the number of hospitalizations and ICU admissions for children under 5 years of age with COVID-19 has increased. COVID-19 vaccination in younger children will increase their protection against severe illness. Even if a child has already contracted COVID-19, vaccination is still important. Even if a fleeting infection offers a certain protection, vaccination improves the immune response and can offer stronger, longer-lasting protection. For children under 5 years of age who have already had COVID-19, NACI suggests waiting 8 weeks after the start of COVID-19 symptoms or a positive COVID-19 test before beginning or continuing the primary series. This interval may be shortened to 4 weeks for children who are moderately to severely immunocompromised. For the moment, NACI recommends that children from 6 months to 5 years of age get a vaccine 14 days before or after having had a vaccine against COVID-19. This precaution will allow us to make sure that if there is a side effect that happens after the vaccination, it will be because of the COVID-19 vaccine. In some circumstances, it may be necessary that the vaccine be administered at the same time as another vaccine. Based on provincial and territorial projections, there will be sufficient supply of the Moderna Spikevax vaccine for children 6 months to 5 years of age. The government is working closely with provincial and territorial partners and understands they will be rolling out vaccination programs for children in this age group. Please check the provincial, territorial, or local health authority website for information on when the vaccine will be available in your area. Beginning a primary series now will offer protection to these young children. It's also the right time to remind everyone to keep their vaccinations up to date and to get boosters, those boosters that are recommended to them. With this authorization, and NACI recommendations will come as a relief to many parents of young children. Some may still have questions about vaccination. Parents and caregivers should speak with a trusted healthcare provider if they have questions. Information is also available on your federal, provincial, territorial, or local public health authorities' website. Thank you. Merci, Miigwech.
Merci beaucoup. On va passer à la période des questions.
Thank you. We'll now go to questions. You can use the raised hand function. We will alternate between French and English with a priority given to press gallery members.
A reminder to use the raised hand function if you do have a question on Zoom, and also a reminder that I will be alternating between English and French questions with a priority given to press gallery members. Alors, on va commencer avec Christian Noël de Radio-Canada.
We'll start with Christian Noël, Radio-Canada. Hello, and thank you for taking my questions. I'd like to know Why is it necessary to vaccinate such young children? Is it a tool in order to keep schools and daycares open this fall? Thank you for your question. Dr. Njoo here. I think I will ask Dr. Berthiaume to comment after me. I think it's another tool because vaccination overall is one layer of protection, a very important one. And this for everyone in Canada who's eligible and who's over 5 years of age. All these people over 5 years of age have been able to take advantage of it. Now there is a vaccination for very young children. And now COVID is less frequent among these young children, but there are children who are susceptible to very severe symptoms and even hospitalization. I think it's also important to help protect them. And I think parents are very happy that we can offer this to young children in Canada. I think that overall the pandemic, well, what's important is that general immunity be as elevated as possible for all Canadians. So I'll leave it at that. And now I will yield the floor to Dr. Berthiaume for his comments. Yes, I'd like to add that it's especially important for schools and daycares. Yes, hello. I think the approval of this Moderna vaccine for children of 6 months to 5 years of age is another option to deal with the COVID-19 pandemic in Canada. There are many advantages in considering this vaccine for our young children. As Dr. Njoo mentioned, we know that there is a lower risk of infection and also benefits which we've seen in other age groups. It's far less severe symptoms, a lesser chance of being hospitalized, less of a chance of contracting long COVID. A study of long COVID in children has shown that this is quite frequently observed in young children, as well as multi-system inflammatory syndrome. And there have been, I think, 4 to 5 cases in Canada among these very young children. This leads to hospitalization and potentially complications in the midterm. So there are many benefits to be considered for families who unfortunately have children. It also has impacts on the family itself. There are risks for parents. And sometimes people come into contact with vulnerable people because of health conditions or age. And this increases risks in the family circle, and being protected against COVID-19 is a very good thing. It's a bit of a challenge when a family has COVID-19 because it goes from one person to the next. It affects all of their activities, social activities, work. So there are many benefits to the vaccine and benefits that would make it a good idea to consider this vaccine to immunize their very young children against COVID-19. Thank you. Dr. Njoo here again. With respect to schools and daycares, I think it's very important that everyone understand that it's not only about continuing school for children, but it's also important for their mental health and social development to be at school and in daycare. With the fact that there are no more mandates, cases are going up. So we're waiting for fall and winter, and when kids go back to school, we may be seeing more infections with the whole gamut of respiratory symptoms. COVID-19 is an infectious respiratory disease, and I think it's always a good thing to be immunized against it. And there are other things, that children can catch at school. Thank you very much. I'd like to follow up with another question. In airports, and this isn't a surprise of what's going on in airports, but why is it that Canada is continuing to do these random tests that are compulsory for the non-vaccinated, whereas anyone can get it? What is the proof we have that this really helps? Thank you for the question. I can only speak about Canada, not about other countries, but here in Canada, this random testing is important for our monitoring program because other variants may be coming into Canada, and it's important to know about this in order to formulate other recommendations. And this is part of our being able to add to the base, the database, and add to various pieces of evidence of what's happening. Now, I think Canada, I can't really say compared to other countries, but I will tell you that we look at this, there are various factors in Canada and in other countries, and that is, what is the capacity of our healthcare system to deal with this? What is the level of vaccine coverage in Canada or in other countries? I think we have very good vaccine coverage in this country, but we also have to look at the risk tolerance threshold. And I think we're doing very well because we've been very cautious, and I believe all Canadians understand that with our collective efforts, we're doing well because we don't have the levels of mortality and morbidity observed in other countries. So I think what we have to do is continue protecting ourselves and others, and we will continue on this path. Thank you. We'll now go to Dylan Robertson.
Hi there. I realize that you're not the procurement people, but does anyone on this panel have any indication of when these modified shots will arrive in Canada and how soon people will be able to actually get them?
So, Dylan, I just so I'm clear on the question, you said modified shots, or are you talking about the Moderna vaccine that's just been approved today?
Yeah, because the release said it had to be 1/4 of a normal shot.
Okay, so it is a Moderna vaccine. What I can say is that, as I mentioned in my remarks, is that even as this vaccine's been authorized, obviously there's been work behind the scenes, and certainly we're in a good position. My understanding is that there will be enough available vaccine, and there will be distributed to the provinces and territories, so they can begin their programs to offer vaccination to this to young children in this age group very shortly.
Thank you. And a two-part question for Dr. Njoo. I'm wondering if we're in a new COVID wave and how important it is for provinces to prioritize these shots for toddlers, given that we have so much going on now with the monkeypox vax, the forced shots, other public health concerns. When you're looking at the epidemiology, how should provinces approach the toddler vaccination, and are we in a seventh wave?
Well, thank you for the question. What I would say is that with respect, to a seventh wave or whatever number of waves we've had, I would defer the provinces and territories. And certainly I've seen that, for the province of Ontario, Quebec, people are talking about a seventh wave. I think it really speaks to the fact that we have to be humble. Our past experience has been that, during the summer, usually the activity of COVID-19 has decreased somewhat, and we're always bracing for the fall. But as you can see with the constant mutation of this virus, and what it's doing in terms of transmission and also maybe a vaccine escape, immunity escape, that we are in the midst, I would say, at least in several of the provinces, of a seventh wave. So that's important to acknowledge. The point about vaccination programs, I would say, starting with the adults, we've done well, but we could do better. The one thing that I think I would stress at this point is that it's so important for, I think, adults 18 years and over to have those 3 doses. We know that the primary series of the 2 doses is important for that baseline immunity, but we also know that immunity wanes over time, and usually by about 6 months or so, there's a demonstrable drop. And so getting that quote 3rd dose, I think, is key. There's still several million Canadians that haven't gotten that 3rd dose, even though we've done quite well. So I think we need to, as they say, up our game in that regard, so that we're better prepared for this ongoing 7th wave, but also for what might happen in the fall. And I think offering the vaccine to, as you said, this younger age group, I think is just part of that. I think it's not sort of one or the other. I think it's part of our comprehensive program that obviously the provinces and territories are rolling out with respect to offering COVID-19 vaccines across all of the eligible age groups.
Boris Proulx, Le Devoir.
Yes. Hello. It seems to me that NACI is recommending an interval of 8 weeks, but Health Canada has talked about an interval of 4 weeks. Now, is the NACI recommendation not going to be adopted by the provinces?
Dr.
Njoo here. I don't think it's the first time. I think there are other recommendations. There are always differences among vaccinations approved by Health Canada. There are clinical trials provided by the company, but there's also experience in the real world, and we observed that with an interval, with a longer interval, it turned out well. And it gave more immunity and more lasting immunity. So, given our experience, NACI has recommended an interval of at least 8 weeks. It's the same recommendation for other vaccines, even for adult vaccines, so it's in line with this. But I do understand that there's a difference between what the company recommends and the interval that we have established given our experience in Canada. I think that the provinces and territories are ready, perhaps, to follow NACI's recommendations given their experience with other vaccines. Thank you. Thank you for the answer. In your documents and in your, when you talk about protecting children from the repercussions of COVID. We also talk about protecting others. In your document, you don't talk that much about the propagation of COVID-19. Do you have anything to say about this a vaccine for babies and young children in order to stem transmission of the disease? Well, I think I would say first that we're always learning, and we're always adding to our knowledge about COVID-19. And as has been said, it's a virus that's constantly evolving and has variations. So it does confer immunity, and I think that the most important thing is to protect people against the more severe consequences of COVID. I'd also like to underscore this, because this vaccine, there are some vaccines that are perhaps less effective against infection with 1 dose, but with 3 doses, this protects really well against severe forms of the infection. Yes, I think in order to complement what you've said, Dr. Njoo, I would say that vaccines for children of 5 months to 6 years of age, it will help to reduce transmission of COVID. Nevertheless, we have data that suggests that it helps to prevent certain other Omicron infections as well. For other age groups, there have been studies done by healthcare professionals on different age groups, and vaccines have overall an impact on the transmissibility of COVID and on the number of infections and even on the viral charge, the viral load. So we have extrapolated that in certain age groups we can expect, or at least we can hope for, an impact on the infection rate, but we cannot affirm this beyond any doubt at this point in time. But as I said, we can project, given the data about various age groups and about the potential benefits of vaccination for these age groups. Thank you.
Ryan Tumulty, National Post.
Yeah, hi there. I wanted to ask about fourth doses. A number of provinces are expanding eligibility to that, but some are also still suggesting that not everyone needs to take that step. Do you have any recommendations, Dr. Njoo, on how people should approach a fourth dose?
Well, thank you very much for that question. What I would say is that, we've said this many times, is that, Canada is such a large country, and the epidemiology from one coast to another coast varies. And so what I think you're seeing is that the provinces obviously have a better handle in terms of what's actually happening on the ground with their quote local epidemiology, be it at provincial level or even at a city level, are in the best position to know what the sort of the state is in terms of circulating virus and what the risks are for individuals. What I would say is that generally, as I've mentioned before, I think everyone would be agreed that based on the science that everyone is aware of, that getting 3 doses to everyone who's eligible, I think, is the key. There's still obviously some work to do, but we're doing quite well. So let's push on the 3rd doses. What we've also seen from the science is that certainly those at highest risk of severe consequences, let's say the elderly or people who are immunocompromised, especially if, let's say, the time that's lapsed since their last dose, be it a booster or even the primary series, has been more than 6 months, and certainly it's a good time to get that additional dose to protect. Obviously, depending on your personal risk factors, what kind of activities you might be undertaking, and obviously, with other recommendations from local officials. So that I think would be the general sort of approach. But certainly, I don't think there's a one size fits all, and I think the most important thing is for individuals to listen to local public health authorities.
Yeah,
I'm not sure, Dr. Tunis, I'm not sure if you'd have maybe any additional points.
No, I think that's a very complete response.
Maybe I'll ask my follow-up in a slightly different way. Is there a downside to people who, aren't in any of those targeted older age groups or immunocompromised? Is there a downside to getting a 4th dose, even if all they really want it for is an extra level of security? I know Canada has plenty of doses available.
It's Dr. Njoo. I think there's probably a lot of opinions out there, even within the scientific community. I would say that if someone were to get a 4th dose, certainly I think it's recognized from what we know from the science that it would be a sort of a temporary or for whatever period of time a boost in terms of the antibodies, but that would wane with time. And what I think is also, I think in many ways, adding to the complexity of the issue is that many individuals have also been infected with COVID-19, the Omicron wave, et cetera. And so we also know that having a sort of what we call natural infection also confers a certain level of immunity for a certain amount of time. So with all that in play, in terms of being a sort of a protected immunity solely from vaccines, or what we might call hybrid immunity, a combination of having a certain number of doses of vaccine as well as maybe being infected with COVID-19, how that plays in terms of someone's thinking about whether they could or should get a fourth dose. I think if they're in that position, they've already had the 3 doses and maybe they've even been infected. I say, hey, you're doing quite well, and let's maybe put the push on for those individuals who haven't had their 3rd dose of vaccine. The only other point I would make is that why we keep stressing about the 3 doses is that from what the science has shown us is that certainly with vaccination, it's a more controlled way of getting your immunity up as opposed to, quote, relying on natural infection. We know that people have been sometimes even reinfected, a number of times, and there's some early evidence, and we're certainly tracking that in terms of some of the long-term consequences, long COVID, and so on. And certainly, I think it's better to get vaccinated and depend on the vaccines for your immunity rather than sort of getting multiple infections, because there's certainly some evidence to show that there may be some longer-term consequences. I would also defer to my colleagues if they have additional comments.
I mean, Dr. Tunis here, I could add, we've heard some discussion about the new formulations, and that's, I think that is something that we understand is coming up as a question. One of those has been submitted to the regulator, and NACI is reviewing in parallel to the regulator about these potential new bivalent booster formulations. They're certainly not available now, but could potentially become available sometime in the coming months if there's a positive regulatory decision around those. So that is part of the challenge, is that we're talking about program transitions now, and we maybe are in a transitional phase between ancestral boosters and possibly moving towards new formulations. It's a very dynamic space, but the authorized products that are available now to individuals are the ancestral products that have been shown to demonstrate good protection. So that's one element of complexity also that's added into this mix. But NACI is reviewing very actively along with the regulator on those new formulations.
Okay. Raymond Filion, TVA.
Raymond Filion, TVA. Thank you. Hello. I'd like to know if there will be a vaccine one day for those under 6 months of age. Well, I'll answer that. At the present time, to my knowledge, there are no studies we've been informed of on vaccines for children under 6 months of age. Do you think it's worthwhile? Do you think it might eventually be worthwhile to vaccinate children under 6 months of age? Well, that's a good question. I think for these children, one of the issues might be, hypothetically, transmission of a mother's antibodies to the child, and this might well immunize a newborn, but studies will have to be carried out. I think in the absence of data, I can't really say if there would be benefits. It would have to be studied. Hypothetically, there could be benefits, but it might be, it could be different. There are all these factors to take into consideration.
We'll go to, Laura Osman, Canadian Press.
Good afternoon, doctors. Thanks for taking our questions today. I wanted to talk about the NACI recommendation. The standard language is that the vaccine may be offered. As a mother of a 2-year-old myself, that doesn't necessarily speak to me. I'm wondering if someone is able to kind of translate that into what NACI really means in terms of advice to parents.
Yeah, it's Dr. Njoo. I think I would turn to Dr. Tunis right away. There's sort of a very sort of scientific approach and very, very careful use of the language that NACI has used historically, which obviously has been the case for COVID-19 vaccines to date, and I don't think they've strayed from that. Certainly at the beginning, when you make a recommendation based on sort of just based on the available clinical data from the trials and so on, they make a certain type of discretionary recommendation, and that as more real-world data comes in, then based on that they might be making a stronger recommendation. But I would turn to Dr. Tunis to expound on that further.
Yeah, that's correct. We've seen a pattern throughout the pandemic with the pediatric vaccines where, while there are risks, the risks are lower than with older adults. And so as those new pediatric vaccines are introduced, the committee has been starting with a may be offered recommendation where, where the evidence may be closely balanced, and the committee is waiting to see further evidence accumulate that would inform the need for these doses in the pediatric cohort under 5. And as we learn more about the vaccine, but certainly the committee is recommending that they may be offered, and is acknowledging that this could be an important protective measure for many parents and of those children that would want to exercise that option, and for the children themselves. So it's that the may and the should language from the committee is really designed to inform the provinces and territories and the healthcare providers in how to understand the evidence and how to interpret that volume of evidence that's available, and think about how that might evolve. So I think really for any parent who's thinking about the decision and is wondering what this means and how to interpret that evidence, I think that's a lot to ask an individual parent, and the best place to have that discussion is with a healthcare provider and or with your local public health unit if you are going to seek a vaccination there. So it's a standard approach that we've seen the committee take with the 5 to 11 vaccine, and additionally with the 12 to 17-year-old boosters as well. When those became available, the committee started with a may be offered, and then as evidence evolved and the level of risk and the level of benefit that can be conferred by the vaccines becomes more clear over time, then that potentially may change. But at this point, they're using their standard approach, which is to introduce this vaccine into the environment as an additional tool, an additional option for parents and for the community to use for protection.
Appreciate that. Thank you. And Dr. Howard Njoo, obviously the uptake for kids 5 to 11 has been a lot lower than that in the general population. The risk-benefit analysis for parents is different with their young kids who, as you mentioned, are at a lower risk of severe illness. So what is the public health agency planning to do, and what should parents be thinking about in terms of sort of combating that hesitance to get this vaccine? And is that maybe a reasonable thing to do at the moment as we wait for more evidence to come in?
Well, thank you for that question. I think certainly not only for this vaccine and for this age group, but in general, one of the things we certainly would like to do is get as much information out there so that parents can make an informed decision. I think it's so important. It's not something that we're forcing on anyone, but it's certainly that we want to make sure that the parents are comfortable. And so it's not a matter just of, quote, providing information that maybe parents can access, be it on a website, but also to support the frontline healthcare providers, because if they have the tools and the information, then they obviously, as a trusted source of information, they can have those discussions with the parents, and then at the end of the day, everyone is comfortable with whatever decision is made. So I think that's how we're intending to support, but certainly that's in conjunction with whatever efforts are being done at provincial and local level.
And we will finish with Jamie from Global News, I believe.
Hi, all. I just wanted to play off that question just a little bit more. So the experts we spoke with today, the infectious disease experts and the pediatricians, say that the decision should be made on a case-by-case basis, that not all families, the vaccine won't be right for all families. Is that something you agree with, just to be really clear?
Yes, I wouldn't disagree with that. Certainly, it's like we've mentioned another tool. I hate to say this expression, another tool in a toolbox. It's another option for families, for young children. But I think it's so important that parents have to feel comfortable. And certainly, I think we mentioned in our remarks that I'm sure there's lots of questions. And please speak to your healthcare provider, your trusted source, be a family physician, a pediatrician, to get the right information, but also have that good discussion, because it really is it's a back and forth, not just kind of a one-way street in terms of giving information. Then it's up to the parent to figure it all out. So yes, I would certainly support a good conversation. And if there's anything we can do, certainly we work with the professional organizations, with the pediatricians, and so on. And certainly we want to make sure that they're well supported with the kinds of information tools they need to have those, quote, informed discussions with their patients.
And my second question is actually about monkeypox. Since cases have risen pretty rapidly here in Canada, do you feel like the general public should have a reason to be more concerned at this point?
Well, I think my general take is that in general, people need to be aware of monkeypox and how it spread. And I certainly, from the evidence and what we've seen today with the epidemiology, it really requires a certain type of a close, intimate contact, physical contact from someone who is infected with monkeypox. With the lesions and maybe bodily fluids. And so, for the general public and even those who are maybe at increased risk, if people understand what kind of activities would put them at greater risk for exposure to the monkeypox, then that's certainly, I think, what people just need to be aware of. I wouldn't say that for quote the whole general population, we need to be concerned to the same degree, let's say, compared to COVID-19, because certainly it's not as transmissible. It's certainly not spread in the same way as COVID-19. But people need to be aware of the mode of transmission. And what we're doing is looking at the epidemiology and working closely with our provincial and territorial counterparts to make sure that both from a sort of a vaccine perspective and making sure that the vaccine is available and offered to those at highest risk, but also working with the communities, because we recognize it's not the vaccines alone that's going to manage and deal with monkeypox. It's also making sure people understand there might be behavioral changes or certain activities that people should be aware of that would put them at greater risk. So certainly it's also an education aspect there as well, in addition to the vaccines.
All right, so that's all the questions we had. A big thank you to all the doctors for your time and for answering questions. And this ends the press conference. Ceci met fin à la conférence de presse. Merci encore au docteur pour votre temps pour avoir répondu.
This ends the press conference. Thank you again, doctors, for your...
Merci. Thank you.